topic of my presentation is the caregivers. Actually, we talk a lot about the patients and the disorders and the illnesses, but sometime and somewhere we forget to talk about the persons who are actually involved in the caregiving process, and they are the caregivers. So my presentation will be on the caregiver burden in mentally ill patients and what can we do? What can we do to bring the change? So I'm from Quetta and my name is Dr. Ramesh. I'm from Blustein Institute of Psychiatry and Behavioral Sciences. The objectives on the layout of the presentation would be definitions, types of caregiver burden, importance, consequence, what we as psychiatrists can do, and the references. So a caregiver, who is a caregiver? Someone who takes care of the person, whether young or old, whether disabled, ill. We define caregiver as a family member or other who has been staying with the patient and has been closely related with the patient daily activities, discussions, care of health. He is related with the patient and the process from which the patient is passing through. Of course, the caregiver has to sacrifice his own needs and wants, and caregiver is an individual who has the responsibility of meeting the physical and psychological needs of the dependent patient. So this is a brief sketch of caregiver. And what is caregiver burden? Caregiver burden actually is the physical, emotional and financial tool of providing care. If somebody is providing care to another person, so all the physical, mental, psychological and financial trauma from which he or she has to pass through is actually the caregiver burden. WHO defines it as the emotional, physical, financial demands and responsibilities of an individual illness that are placed on family members, friends or other individuals involved with the individual outside the healthcare system. Now this is very important to consider. Most of the time and all the time we see the healthcare system in which the caregivers are not from the healthcare side, they are from either the family or the close relatives. So types of caregiver burden, it has been categorized into objective burden, subjective burden and demand burden. What is objective burden? The extent of disruptions or changes in various aspects of caregiver's life and household. I think all of us have passed through the process of caregiving somewhere in life. So we feel we do have this sort of burden. We have objective burden where the family life, the personal life is disrupted. We have the subjective burden where the emotional reactions to the caregiving experience occur. And this is the burden which most of the time we see in the hospital setting where a lot of violence erupts and the people break down the glasses in casualty or emergency room, and the people do the violence at hospitals because they are passing through a subjective burden which we as psychiatrists must know. The demand burden is the extent to which the caregiver feels the responsibilities are over demanding. Sometimes the responsibilities are that much over demanding that the caregiver is unable to process that. The assessment of burden is becoming a challenging task. Why? Because most of the research in any part of the world where it occurs, there are certain cultural values, ethical values, religious and personal values. They actually are a sort of hindrance in the measurement of that burden. Sometimes we don't measure the exact level of that burden from which a patient is, from which a family is passing through. So important consequence, psychiatric patients need assistance and supervision in their daily activities, as we all know. This supervision places a great burden on the caregiver. Caregiver face a lot of strain, ill health, disrupted family life, and literature suggests that increasing concern about the coping abilities of those caregivers. I think the coping strategies are the most important one because somewhere in hospital setting I'm not talking about all about psychiatry, maybe that we are doing that better there, but the coping strategies are not undertaken by departments as we see. They don't work on the patient's family's coping strategies, which results in certain consequences. And the needs of the caregiver of the mentally ill are often given low priority. I think all of us, when we are in the process of treatment, as we are clinicians or researchers, so we place most strain on the patient and the but we don't have that much priority for the caregivers. So the caregivers are often neglected. The most common mental health consequence identified in caregivers are depression, anxiety, and burnout. Yes, they are most common and they must be seen and checked. So most of the notable community-based studies gives us result that 18 to 47% of caregivers, they have depression. And caring for someone, now this is very interesting, caring for someone with psychiatric illness, it has been proved by research that caring for someone with the psychiatric illness puts somebody at a higher level of stress as compared to caring for someone with any functional or physical impairment. So this is very important. Now what psychiatrists can do, what we can do, we can identify the burden in caregivers. Early identification and suitable intervention is the most appropriate way. There must be a support-based system. Now, family interventions have got a very important place here. Psychoeducation and family interventions, although most of us will be doing that, but I would like to have a look here at the family-based interventions. Why they are important? Family members are the primary caregivers of the patient, you know. In most of our families in non-Western world, the family members are those who are put in the caregiver burden. So caregiver has a multiple roles, of course. He takes care of the patient, he does supervise the medication, he or she takes the patient to the hospital and takes, of course, take care of the financial needs of the patient. So all the strain is on the family members. So family-based interventions are important. And in family-based interventions, there is evidence of reduced relapse rate and negative impact of psychosis on caregivers and can negative attitude, and even it increases the willingness in the care process. Even APA and NICE guidelines recommend that even in schizophrenia like psychosis, we have family interventions which are very effective. So the sessions with the families are often a brief introduction to the illness, presenting symptoms, early signs of relapse, treatment, efficacy, safety of treatment, common side effects. Something very important to consider here, treatment related costs, identifying burden and coping methods. They are also important in the therapeutic process when you are working with the caregivers. Day-to-day problems, management of patients should be discussed, and simple and practical solutions could be there. Simple behavioral interventions like anxiety and stress management should be taught to the caregivers. The sessions may be held weekly, fortnightly, but they are very effective. And the number of group members may vary from 10 to 12 or 15 to 16. Family caregivers who are in contact with treatment teams, now this is the evidence-based thing, that family caregivers who are in contact with treatment teams for a long time, they learn to develop healthy coping mechanisms. The burden of care is reduced, the severity of mental illness is experienced, and the prolonged therapeutic contact with the treating doctors results in good treatment results. These are a few references, and let's care for those who care for others. Thank you very much.